I now would like to yield to Mr. Altmeyer to introduce your witness.
Thank you, Madam Chair, and it is my pleasure to introduce Professor Timothy Jost. Professor Jost teaches at the Washington and Lee University School of Law. He is co-author of a casebook, Health Law, used widely throughout the United States in teaching health law. Professor Jost is the author of numerous articles on healthcare regulation and comparative health law and policy. He is also consumer representative to the National Association of Insurance Commissioners. Professor Jost earned his J.D. from the University of Chicago School of Law, cum laude. Welcome, Professor Jost.
Thank you very much, and thank you, Ranking Member Elmers and Congressman Altmeyer and Congressman Kingston. The title of today's hearing is Small Business and PPACA. If they like their coverage, can they keep it? This is a variation of one of the commitments made by the Affordable Care Act, realized in Section 1251, that if you like your plan, you can keep it. But notice, the ACA's commitment is to individuals, not to employers. It is not, if you are currently have insurance through your job, you're stuck with that insurance no matter how it changes. It is, if you, the employee or individual enrollee, like your coverage, you can keep it. In fact, most privately insured Americans do have insurance through their jobs, and regulations adopted last summer by Labor, Treasury, and Health and Human Services give employers considerable flexibility to change their plans without losing grandfather status. Employers can change their formularies, provider networks, and even insurers or plan administrators. They can increase deductibles, out-of-pocket limits, and copayments not only to keep up with medical inflation, but up to 15% more. They can reduce their own contributions to premiums by as much as 5%. They can add new employees and new dependents. Of course, if the plan changes too much, it ceases to be the plan it was. It's probably no longer the plan the enrollee liked, and grandfather status is lost. The Department's projected that 15 to 33% of plans would lose grandfathered status in 2011. Private surveys cited by Mercer and Hewitt in submitted testimony predict higher levels, although they also noted that many employers do not really view loss of grandfathered status as a major problem, and some said they wanted to comply with the new law as soon as possible. The NFIB survey released last week, surprisingly, did not reflect widespread loss of grandfathered status. The NFIB reports that 90% of small businesses intending to make significant changes in their plan have not lost their plan. It does report that 12% of employers have had their plan terminated or been told that it will be not available in the near future. This number is consistent with churn in insurance coverage observed in earlier years, and I believe I cited a 2008 NBER report which showed this kind of turnover in the early 2000s. Plans are always coming and going in the small group market. NFIB also reported that 20% of employers anticipated significant changes in their plans over the next 12 months. But last year and the year before, changes in benefits, cost sharings, and premiums, as reported in the annual Kaiser HRET report, were at even greater levels. This is a bad time in the economy, as we all know, and things are changing. Another very important question is whether employers will continue to offer coverage after the ACA is fully implemented. A number of studies have addressed this question. Their predictions range at the extreme from those of Dr. Holtz-Eakin, who predicted that ESI would shrink by 22%, and the McKinsey survey, which claims that 9% of employers will definitely drop coverage, to those of the RAND Corporation, which estimated that coverage would in fact grow by 8.7%. But most studies, including studies by Booz, Lewin, Urban, Mercer, Towers Watson, and most importantly the CBO, predict that coverage will not change dramatically once the ACA is implemented. In fact, all of the reason employers offer insurance now will continue to exist after health care reform goes into effect. Most importantly, employee benefits are exempt from federal and state income taxes and payroll taxes. In Virginia, where I live, an employee taxed at the alternative minimum tax marginal rate of 28% receives a subsidy of over 49 cents on every dollar for the coverage that they receive through their employer. The average American covered by ESI has an income of 423% of the federal poverty level and would not be eligible for any of the premium subsidies under the Affordable Care Act. Employers who drop health insurance would have to dramatically increase after-tax cash compensation for their higher income employees to cover this loss of tax subsidy, and the law prohibits them from dropping benefits from their lower wage employees but keeping them for their higher wage employees. Health benefits also continue to be one of the most highly valued forms of compensation and also help ensure a healthy and productive workforce. After 2014, employees are even more likely to demand health insurance at work because of the individual mandate, and large employers, not small employers, large employers will face a penalty if they don't offer insurance. In Massachusetts, which adopted similar reforms in 2006, employer offer rates grew from 70 to 76%. There is every reason to believe that the ACA will not dramatically change the scope of employer coverage in the United States. Thank you.